overactive bladder, also known as OAB, is a very common condition that affects millions of women around the world. It causes a sudden and almost impossible to control urge to urinate, which can lead to anxiety, discomfort, and even embarrassing situations. If you have been noticing changes in your urinary habits, like urgency or going to the bathroom more frequently, this video is for you. Understanding these symptoms is the first step toward regaining your quality of life and finding the right treatment. The symptoms of OAB often appear together, although their intensity can vary from woman to woman. One of the most noticeable signs is urinary urgency, that unexpected and intense need to run to the bathroom immediately. Many women describe it as a feeling they simply cannot postpone. Another common symptom is increased daytime frequency, having to urinate more than 8 times. Within 24 hours may be a sign of an overactive bladder. Nocturia, or waking up 2 or more times at night to urinate, is another major indicator, and it disrupts your sleep, leaving you tired the next day. In some cases, urge incontinence can occur, meaning urine leaks right after the sudden urge. It's important to remember that overactive bladder is not caused by a urinary tract infection, and it usually does not show up in routine lab tests. It's diagnosed mainly based on the symptoms themselves. Even though these symptoms might sound simple, they can deeply affect many areas of a woman's life. Some women start avoiding social events, travel plans, and even daily activities because they're afraid they might not find a bathroom in time. Sleep becomes fragmented due to nocturia, which affects energy levels, focus, and overall well-being the next day. The frustration of dealing with sudden urges and leaks can lower self-esteem, create feelings of shame, and contribute to anxiety or even depression. Relationships and intimacy can also be affected by the discomfort and insecurity caused by OAB. If you recognize these symptoms in your daily life and feel they're interfering with your routine, it's important to seek medical help. A urologist or gynecologist is the right specialist to evaluate your situation. They will talk to you about your symptoms, ask about your medical history, perform a physical exam, and may request additional tests to rule out other conditions such as urinary tract infections, bladder stones, or neurological issues. The good news is that there are several effective treatment options available for overactive bladder. In many cases, simple lifestyle changes can already make a big difference, reducing caffeine and alcohol, controlling fluid intake, and practicing bladder training techniques to gradually increase the time between bathroom visits. Pelvic floor therapy, including exercises like Kegels, helps strengthen the muscles that control urination and can significantly improve symptoms. If needed, there are medications that relax the bladder and reduce urgency. In more severe cases, advanced treatments such as sacral neuromodulation or botulinum toxin injections into the bladder may be recommended. Overactive bladder is common, but it should never be ignored or seen as something you just have to live with. Recognizing the symptoms is the first step toward regaining your comfort, confidence, and freedom. Millions of women deal with OAB, but with the right diagnosis and treatment, it is absolutely possible to manage the symptoms and live a full, active, and stress-free life again. You are not alone. Taking care of your health is the most important gift you can give yourself.